Strike the anterior region of the elbow with a hammer. The doctor now is holding the arm and striking on the region of the triceps tendon with a hammer. The arm must be relaxed so the reflex can happen. To check the brachioradialis reflex, the examiner must hit the distal region of the radial bone while the patient's arm is relaxed. The patient seated, the examiner strikes the patella tendon of the patient's relaxed leg.
The doctor showed us that if the patient is concentrated in something else, the reflex is easier to happen. The patient has to be laying somewhere. The foot has to be shoeless and he must be relaxed. Then the examiner has to hit the Achilles tendon located on the posterior region where the articulation meets. The patient's jaw must be relaxed and slightly opened. Then, with the hammer, the examiner must strike the masseter muscle located on the gonion region of the jaw. To check the Babinski reflex, you have to pass an object through the sole of the foot. If there is no movement, it means that the patient has no pathology.
To do the Hoffman reflex, you have to push downwards the tip of the finger, and if the thumb has no movement, it means the patient is healthy.
To check the palmomental reflex, you have to brush your thumb through the thenar region. If the patient's shin does not move, means that the patient is healthy and there is no pathology. To check the glabellar reflex, you must tap on your patient's forehead repeatedly. If the patient does not blink, this means this is a normal sign and he has no pathology in head.
When the baby receives the stimuli on the cheek, he must rotate the face towards the thumb, looking for suction.